This time I will speak about the research types, designs, and methods. And these words are interconnected with each other. And for this interconnections, they cause some confusion for some people. I will just break out this confusion and give a lot of examples to make it very clear and very simple. And the first thing I will discuss or describe the types. And the research types are three types usually. These are classified according to the purpose or to the type of data or to the objectives of the research. When it is classified according to the purpose of the research, then it is either an applied research or a basic research. The applied research is the research that is performed to solve a real existing problem. In contrast to the basic research, which increases the knowledge, like research in tissue healing. Most of the researches we are conducting in our country are applied research. They tend to describe or solve a real world problem in the country. And when the research is classified according to the type of data, it could be a quantitative research or qualitative research or mixed, both quantitative and qualitative, which is called mixed method. And it could be also classified according to the objectives of the research. And it could be an exploratory or explanatory, or it could be a descriptive research. The descriptive research describes phenomena, a phenomenon, or describes a population, or describes an experience or perception, while the explanatory, it explains the associations between the variables we are studying in the research. In addition, the explanatory, it explains the causation or the effect or the prediction of a cause of a disease or a phenomenon or a problem. So there are three types of research described according to the purpose, being applied research or basic, according to the type of this data, being quantitative, qualitative, or mixed method, or according to the objective, being explanatory or exploratory or descriptive research. Now we have to give some examples. In fact, just to reach the type of the research, one can ask, what is the research about? It is about solving an existing problem, then it is an applied research. It is about a quantitative data, analysis of a quantitative or qualitative data or mixed data. Or it is about explaining the causes or the impact of something on another issue. Or it just describes the phenomenon or the way people think, the conception or the perception, and it could be also, it can explore the relationships within the research itself. Also, we can ask why to do this research. To do this research is to solve a real existing problem, or to do this research to describe something, or to explain something, or to explore relationships. These questions, what is the research about, and why it is done, or it is being done, the answer will give us the type of the research. In contrast, the design of the research, if we ask how is this research being constructed, or how is this research being structured. Now we are going to speak about the designs of research. If we take an example, for example, for a research title, Practices of Antibiotic Choice on Prevalence of Surgical Site Infection amid Sudan War. Is this a good title? Yes, it is. Because it is feasible to be done, and it is interesting if it is done, and if it is relevant to our real practice. And it will be novel if it involves the interaction or the impact of the war on the practices, on the prescription of antibiotics, and on the prevalence of the surgical site infections. If we introduce the impact of the war on these issues, then it will become a novel, if you remember the eponym Heiner. And it is an applied research because it solves the real problem. But what type of data is this research? Practices of antibiotic choice, it seems to have two limbs in research. The first part in the research is speaking about practices. How is antibiotics being prescribed by clinicians? And we can design a questionnaire to the clinicians, whether they were registrars, specialists, or consultants, to tell us on what basis do they describe or prescribe antibiotics. Is it because of availability amid war, or because of the price, or because of availability, or because of a special personal preference, or because of the action of the antibiotic, being it is narrow, specific, targeted, and it is narrow in its action, or wide-based action. It covers a lot of bacteria. It is broad-spectrum antibiotic. On what basis do clinicians amid war prescribe antibiotics? So in the first part, we are going to use a questionnaire, means it is a qualitative type of data. The second part is speaking about prevalence of surgical site infection. And the prevalence means we are going to see the prevalence of the narrow and target antibiotics, or the broad the prevalence of surgical site infections in broad spectrum antibiotics, or the prevalence of surgical site infections throughout the use of all these types of antibiotics. So these are numerical data. We are going to collect numerical data about prevalence, which are percentages, the number of cases present divided by the number of persons that can be affected by the surgical site infection, and we multiply by 100. This is a prevalence in a specific time, and the time of the research, 3 months, 6 months, whatever, 1 year, according to the time of the research. So this is numerical data. It is a quantitative data. Therefore, this research is mixed method research. And it seems to be an exploratory, it explores the relationship between the way clinicians prescribe antibiotics and the prevalence of the surgical site infection. Now let us go for the designs and give also examples. The design is the answer of how it structured, how the research is structured. And it depends on the type of the data. The data forms an overarching structure. Inside this overarching, there is a good structure which can be a cross-sectional structure or cohort structure, case series, case control. All are sort of descriptive studies and can be mixed also. Anyhow, it could, and the design could be a quantitative type structured as cross-sectional study or randomized control study if it is experimental. If it is interventional, then it could be a randomized control trial. And if it explores correlations, it could be a cross-sectional study. I will speak in separate videos about each of these designs: cross-sectional, cohort, case series, case control studies. It could be a descriptive research based on qualitative data, or mixed method. Mixed method means involving the 4 types of researches, or even the 5 types of researches I have just mentioned: cross-sectional study, cohort study, and a case series and case control. The mixed method here gives more depth about the knowledge or the facts within the research. And to reach the name of the design, we can just ask, how is this research being structured? It is structured as quantitative type of research, as cross-sectional research. And let us have an example to make things more clear. The influence of third-generation cephalosporins versus quinolone on incidence of surgical site infection amid Sudan war. Also, this is a good title. It is concise. It is composed of some keywords: influence of cephalosporins, influence of surgical site infections. These are keywords, which makes easy, if this research is published, it will be easy to be retrieved by the keywords. If we write the keywords, then we can retrieve the research. And it can be indexed by the journal in one of the databases, one of the international databases. So again, it follows the finer description of the word, finer eponym. And it is again composed of 2 parts of the research: the influence of third-generation cephalosporin and quinolone on incidence of surgical site. Here it seems to be a correlation. We want the correlation between these 2 types of antibiotics, cephalosporins and quinolones, and the incidence of surgical site infections. So it is an applied research to solve problem amid war in Sudan, and it is a mixed method type of research, or it could be quantitative type of research. And it is a cohort sort of a study, and I will speak about cohort in details in another video. Now let us speak about the method. The method is very easy to describe. The method is the method or the tools of data collection and the method of data analysis. This is the method. The method describes the data collection tools and describes the statistical analysis. Very easy. And also these will be described in details in a coming video. In the data collection, we use surveys or interviews or observations, or it could be an experiment to be done. And the statistical analysis, we know it is the frequencies, the means, standard deviations, t-tests, different types of t-tests, regressions, different types, and thematic analysis. Thematic analysis usually from questionnaires. When we have open-ended questions in a questionnaire, then we can collect similar answers and put them together in one theme. And in fact, when we write the questionnaire, for each theme, we write 1 or 2 questions or 3 questions. For each theme, for each aspect in the questionnaire, we write 1 or 2 or 3 questions. And the answers for open-ended questions, we can just put it together in themes, and then we do thematic analysis. And now let us speak about more examples to make things more easy. These interconnected words are really confusing sometimes. Now let us speak about this research and give an example. Here, outcomes of emergency general surgery cases managed by a rotating registrar, a case series study. Now we are describing a design case series. This is how we structure this research in a case series. And it can be done by a registrar just to get all the cases he has operated, emergency cases he has operated, either in the first year or in the second year or in the third year or in all the 5 years or in 2.5 years before the mid exam or in the 5 years. What types of surgical cases, what was the outcome of these cases, and make some discussion about it and probably some relations and correlations in his work. Also, it can be just about, let us say, appendectomy. It is an emergency operation, or about surgical wounds, or about war injuries. Just to collect these cases from his logbook and the details from the hospital medical records. However, because we need details from the files of the medical records, some data might be missing. This is a problem in case series. And when we feed all the data to an analytical statistical program like SPSS, we have to review, before doing the analysis, we have to review the whole data. Probably one patient has been repeated once or twice. So we have to clean this data from the repetitions. And sometimes we find a data for one patient is contradicting the several findings of that same case. Either we have to go to the review file or to find the solution, or to go to the patient and ask about it again. And since we are collecting data from hospital records, the difficulty also is to contact the patients. Probably the patients have been displaced from one place to another amid war. We have to find a way to contact them, to clean this data and to make the correct data. If we find in the data of one patient, some areas are missing, and we deleted that patient, the sample size will become a small sample size, and this will affect the power of analysis. So we should follow there are some statistical methods to amend these deficiencies. I will speak about either in this video or in the subsequent videos. Now we said outcomes of emergency general surgery cases managed by a rotating registrar in whatever period, whatever kind of emergency general surgery cases. Just as a case series, the structure is case series, in which he is going to tell us about the frequencies of the ages and the number of males and females, and probably their residence and their complaints, the main suffering complaints, and the physical findings and the interventions he has done, the type of surgery he has done or she has done, and the outcomes of that surgery, whether they develop a wound infection, dehiscence of the wound, or they develop a DVT, pulmonary embolism, cardiac arrest, whatever, or they passed. So again, what type is this? We can ask, what was it done for? To solve a real problem. So it is an applied research. And this is the type. And the data will be numerical data collected from medical records. So it is a quantitative data, or it is description. It is a quantitative data, and it is a descriptive research. And the design, as I said, as it is written here, it is a case series design or study. Let us now discuss another example, or speak about the case series. I think I have already mentioned about this. Usually it is a retrospective sort of a study, and usually it speaks about prevalence and about frequencies and about associations. And in the statistics we can use also univariate regressions to find out associations and some sort of relationships. But we should interpret the findings with caution. Usually it is a sort of weak study, but it is a base for future studies. It is just a base for future studies. So it can be prospective, but it does not measure incidence, and it does not measure anything related to the cause. It does not tell us about cause or prediction or risk factors. It can suggest probably a cause for a complication or something like this. For future studies to confirm if that is really risk or not risk for a complication. However, I think it is a good type of research, and it is good, it matters for the council to look at how training is going, and it can be done by so many registrars to compare the patterns of cases, the emergency cases they were doing. Probably one of the registrars is doing more war injuries, and probably another one is doing more emergencies in other diseases, but not war injuries, no traumas. So it gives us the pattern, and it is good to look back into the training program itself. I think it can be done by several registrars, and at different levels, in the first year, in the second year, in the third, fourth, or fifth year, or in the 5 years collectively together. I think it is a very important one for planning. Now the research type, which we said it is, the research type is either applied or basic, and it depends on the type of data, and either it is explanatory, exploratory, or descriptive research. Let us look at this title. Practices of antibiotic choices on surgical site prevalence amid Sudan war. Again, these are just different wordings. By practices of antibiotic choices, it means on what basis do clinicians prescribe or choose the antibiotics for their patients? And is that associated with the prevalence of surgical site infections during the period of war? I think it is again an applied research to solve or to give an idea about a real existing problem, and it will use mixed method, because we are going to make a questionnaire for the clinicians, registrars, specialists, or consultants, and at the same time we are going to collect quantitative data about prevalence, the percentages of prevalence with the different types of antibiotics. And now what design is it? The design here, he said, it is a concurrent mixed method cross-sectional study. Now this word, if we are designing a questionnaire to the clinicians, and at the same time, in one and same time, we are collecting the numerical data of the prevalence of surgical site infection, means we are dealing with the two parts of the research, the quantitative part and the qualitative part, at one and same time. So it is concurrent, mixed method. But if we have done one, if we make a questionnaire and we ask the surgeons, and then after that we went and analyzed the data from the hospital records, then it will be sequential, one after another. Or if we did the reverse, if we analyze the data of the surgical site infections from the medical records, and we made the analysis of the prevalence and frequencies of infections and the diseases and the types of surgeries done, and predisposing factors met, or comorbid factors. Some patients were diabetic, some were hypertension, some have renal problems or renal failure or something. And then after that, we made a questionnaire to explain more how the clinicians are prescribing antibiotics amid war in Sudan. In this case, one design is coming after the other design. So it is a sequential. It depends on what we want to do it. Is it concurrent together, they come together, or one comes after another? Now also let us look at this, the influence of third generation. It is the same previous example, the influence of third generation cephalosporins versus quinolone on incidence of surgical site infection amid war in Sudan. As I said, first we describe the research title. It is a good research title, and we know how to describe the research title. And then what is remaining is to speak about the design. What design will be this one? The design will be a cohort study. A cohort study also, I will speak in another video in details about the cohort study. It could be prospective, but most of the time it is retrospective. However, it could be hybrid, part of it retrospective and part of it prospective. And usually start with exposure. And then we follow the patients to see the effect of this exposure, whether they are going to develop the complication, or they are going to develop the disease, or are they going to develop the outcome we are studying. This is a cohort study. It is how the design is structured. And as I said, later on I will speak in details about the cohort and the methods of analysis. And now let us make some sort of comparison between these designs. Between the cross-sectional, the first example we have given, and the cohort study. As I said, most of the time both of them are retrospective studies. Most of the time both, but they can be prospective and they can be hybrid, retrospective and prospective. However, the cross-sectional describe the relationships in a snapshot in time, in a specific period in time. It speaks about prevalence in the study period of the research, 3 months or 6 months or 1 year. The cohort usually takes long time. It is a longitudinal sort of research. It starts with exposure and it continues till we reach the outcomes. Therefore, it can tell us something about the risk for a problem, or the risk or a positive, probable, most likely cause for a problem when we follow the patients for a long time. And usually in the two, there are two groups. We follow the two groups. And both are feasible. However, the cohort is difficult. The cohort is difficult because of some patient will leave the area, will be displaced. Some attrition will occur in our data. And we have to try to find a way to follow up these patients. And ethically, some patients in the prospective studies might not want to continue in the research. Their preference is to stop giving answers for the questions in the research. They should feel free. And both are easy to do. However, the cohort study is more difficult and it takes a long time, and it costs a lot of money because of the follow-up. The cross-sectional does not, it speaks about correlations only, about associations, about relationships. It does not speak about causation. However, the cohort can tell us during this follow-up the possible or probable cause for cause and effect. And the cross-section being a study in a specific period in time, it speaks usually about prevalence in 3 months or 6 months or in 1 year, something like this. However, cohort can speak about incidence. The cohort speak about the existing cases in prevalence, and the cohort speaks about new cases, building up new cases with the follow-up, speaking about incidence. The cohort study, the result of cohort study cannot be generalized to other settings. Probably other settings are different. But the cohort study can be, a result can be generalized. Now let us look at this example. Association between preoperative providone iodine versus chlorhexidine skin preparation and surgical site risk in elective hernia repair, a case control study amid Sudan war. Now we are speaking about another design, a new description on how this research will be performed. The design will be how it will be case control. And also most of the case control are retrospective usually. Although it mentioned case and control, but usually there are 2 types of patients and we follow them. It can be prospective, but most of the time it is retrospective. And in fact, it can come out from a cohort study. From a cohort study, then we can select some cases to formulate, it is called netting. We can select cases to form a control study, and I will speak about the details of a case control study in a subsequent video. We follow a group of patients and we compare it to another group of patients. And now let us compare also these designs, case series and case control. The case series is one group, while the case control contains 2 groups, in which there are group comparisons. And however, there is some sort of complexity, and the outcomes also one should be very cautious about writing a conclusion in these. It cannot be, it is not generalizable easily at all. It is also a sort, the case control is difficult, but the case series is very easy to construct and very easy to do the analysis. Both of them, the case series does not speak about causation. The case control might mention that probably, possibly, the cause is so and so for future studies to confirm that. And the problem also in the 2 groups of the case control, there could be lots of confounders. Like some patients in one group could be diabetic and some patients could be having another problem interfering with the variables. The case control needs follow-up. However, as I said before, most of the time it is a sort of retrospective study. And the case series usually no need for follow-up because something has been done and it is organized and to be published. And usually publication in local journal. Most of the case series are published in local journals. Now, comparison between the cohort and case control. The cohort takes longer time than the case control because I said most of the time it is retrospective, it doesn't take much. And the case cohort, the cost is high. And because of the follow-up in the cohort study, there will be attrition in the cases, in the number of cases, because they will be displaced. Some of them will refute continuing with the research, and some of them might die or get lost, and something like that. And the case control, in fact, both of them can speak about causation, but the best research to speak about causation is the interventional research case control study, randomized case control. Randomized case control is the best for causation. And in statistics, the case control, usually we use odds for associations. And I will speak about this when I speak about the case control by itself in a specific video in the future. In contrast, the cohort study usually speak about risk factor and absolute risk. As I said, the research type can be easily mentioned when we answer the question, what is it about? Or why is it being done? And the research design is how the research is structured. And the method is the tools used for data collection and the methods used for data analysis. And these methods are usually systematic. They go stepwise, very meticulous statistics, and to reach answer for the research question and the research hypothesis that I was speaking about in my previous videos. To this point, I end this talk. To see you in the coming video, hopefully to be interested, and I will talk about these designs, each one in a separate video, one after another.